The digestive system consists of the gastrointestinal tract, or alimentary canal, and accessory digestive organs. Food enters the tract at the mouth and is processed by the organs. The contents that leave the system at the end of the tract are primarily undigested food. Click the small intestine to reveal its functions. Most digestion and absorption occur in the small intestine. The stomach delivers chyme to the small intestine in little squirts. The rate of delivery matches the processing capacity of the intestine. Juices in the small intestine neutralize the acidic chyme, restore normal osmolarity, and continue digestion of macromolecules. Breakdown products of macromolecules are absorbed across the intestinal epithelium into blood or lymph. Click the small intestine to observe its unique anatomical features. The small intestine has three regions: duodenum, jejunum, and ileum. The duodenum is just 8 to 11 inches long. The total length of jejunum and ileum is 8 to 13 feet, the jejunum slightly shorter than the ileum. Click the external surface of the small intestine to see the interior structures. The interior of the small intestine contains many permanent circular folds called plicae circulares. The duodenum has few folds. Its function is to neutralize chyme and render it isosmotic. The number of folds is greatest in the jejunum, where most absorption takes place. Plicae circulares increase the absorptive surface area of this organ. Click the plicae to study additional features that increase surface area. The plicae are covered with finger-like projections of the mucosa called villi, which also increase the absorptive surface area. Villi are longest in the jejunum and shortest in the terminal ileum. Click the villi. The columnar epithelial cells of the small intestine have many tiny projections on their luminal surface called microvilli that further increase the absorptive surface area. The surface is called a brush border because it resembles the bristles of a hairbrush. Click the villus to learn about immune functions of the small intestine. The GI tract provides an entryway into the body for pathogens, as well as for food and drink. Cells throughout the upper GI tract secrete antimicrobial agents, and gastric acid renders chyme nearly sterile. Some intestinal villus cells secrete both antibacterial enzymes and immunoglobulins. In the distal ileum, there are lymphoid nodules in the connective tissue beneath the epithelium. Normal bacteria from the large intestine may enter the small intestine. Lymphocytes in the nodules prevent these bacteria from entering the bloodstream. Click the villus to begin study of the large intestine. The small intestine delivers chyme to the large intestine. Water and salts are absorbed from the chyme as it progresses through the large intestine. Bacteria normally present produce some vitamins that are also absorbed. Click the large intestine to observe its unique anatomical features. The large intestine has subdivisions including the cecum, appendix, colon, including the ascending, transverse, descending, and sigmoid colon, rectum, and anal canal. The outer longitudinal layer of the muscular wall is reduced to 3 bands called tinea coli. Contractions of the inner circular layer of muscle form the sac-like impermanent haustra. Click the anal canal to study its histological features. In the distal anal canal, the simple columnar epithelium that began in the stomach changes to stratified squamous. It protects underlying tissues from abrasion. The anus is the outlet of the GI tract. The feces eliminated from the GI tract are primarily indigestible food combined with bacteria, inorganic material, and sloughed-off epithelial cells. Sphincters separate the organs of the GI tract. They control the entrance of food into the tract, control the progression of material along the tract, prevent reflux of material, and control the elimination of feces. Click any of the sphincter buttons. The upper esophageal sphincter is a thick layer of circular muscle at the superior end of the esophagus. This sphincter is skeletal muscle, and when constricted, it prevents air from entering the esophagus. Click the return button to revert to the original diagram. The lower esophageal sphincter, or gastroesophageal sphincter, is at the gastroesophageal junction. No thickened circular muscle is present. A zone of increased pressure, called a physiological sphincter, functions like a circular muscle. When constricted, the lower esophageal sphincter prevents reflux of gastric contents into the esophagus. Click the return button to revert to the original diagram. The pylorus has thick muscular walls. The greatly thickened circular muscle is called the pyloric sphincter. It controls the rate of gastric emptying, hence the name pyloric, a Greek word meaning gatekeeper. Click the return button to revert to the original diagram. The ileocecal sphincter, or valve, separates the terminal ileum from the cecum. Distension of the terminal ileum opens the sphincter to permit the flow of chyme into the large intestine. Distension of the colon closes the sphincter, preventing reflux into the ileum. Click the return button to revert to the original diagram. There are two anal sphincter muscles. The circular smooth muscle of the anal canal thickens to form the internal anal sphincter. It is under involuntary control. Skeletal muscle surrounds the anal canal to form the external anal sphincter, which is controlled voluntarily. Relaxation of both anal sphincters permits defecation. Click the return button to revert to the original diagram. The salivary glands, liver and pancreas, produce secretions that are discharged into the lumen of the GI tract. Click any of the buttons to study the accessory glands. The salivary glands produce saliva that moistens ingested food and cleanses and protects the mouth. The salivary glands produce saliva that moistens ingested food and cleanses and protects the mouth. The major digestive function of the liver is production of bile. It is produced continuously by hepatocytes and is stored and concentrated in the gallbladder. Bile is necessary for the digestion and absorption of fat. The exocrine pancreas produces digestive juice that contains enzymes to digest all major foodstuffs. It also produces bicarbonate to neutralize acidic chyme from the stomach. Here's a summary of what we've covered. The digestive system consists of a muscular tube and accessory organs. The wall of the GI tract from stomach to anus has 4 layers. The stomach stores and digests food. Most digestion and absorption occurs in the small intestine. Accessory glands produce juices that support digestion.